Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everybody. Going to learn a lot today. And even in the 10 seconds that I talked with both of these people, I've learned about a challenge, a physical challenge that many of us have, including one of my friends, and how a certain type of massage, we'll call it that, clinical massage therapy, can help. We're talking about neuropathy. That's just one of many things it supports that I've learned along the way when I've talked to KellyAnne Riden, who is back with us. How are you doing today?
I'm doing well. How about yourself, sir?
Very well. Looking to learn. And you've invited somebody else to the party today. Who do we have with us?
This is Mr. Pastor Ryan, who has been a client of mine for years.
Several years, yeah.
Several years now. Yeah, I think we'd like to just get his point of view on being a client, what to expect, and how the craniosacral therapy has helped him out. And I believe you've gotten both. You've got the massage, massage and cranial work.
And cranial work, yeah.
Yeah.
Wow. Well, Pastor Ryan, welcome. Appreciate it.
Yeah, thanks. Good to be here. Really glad to be a part of this and supporting KellyAnne and her amazing work.
I have to say, before we begin, her passion for her work is just off the charts. Every time we get together, you can feel her passion for it. Like, this is her purpose, and she runs deep in craniosacral therapy and other modalities too. So for you, Pastor Ryan, what brought you both together?
Yeah, so it's actually interesting. We were I met KellyAnne through another counseling organization that I was a part of, and was back in 2016. I was diagnosed with multiple myeloma, which is bone marrow cancer, and through the treatments and the all the chemo and the medications, and we knew that through specifically a number of those treatments, neuropathy could be a reality, and started probably in about 2018, started to notice it primarily 2017, 2018 in my left foot. And, I'm at that time I was only like 40 years old. So I was like, the last thing I want is to not be able to walk. I'd rather in some respects deal with a cancer than inability. And so just started, looking at ways, ideas, came to see KellyAnne for some massage just because, my body was all out of whack. And that's when she suggested, like, let's try some craniosacral work and see if we can't get some of the nerves to start, flowing and she can use the technical terms far better than I can. I'm like, get them flowing, right? Like, let's get them re-firing. And within, I want to say, a relatively short period of time, it wasn't like years. It was within a few months, really started to see a reduction of that numbness in my foot, to the point where even my doctor, who is one of the top specialists in multiple myeloma, asked for cards because he couldn't believe. Because again, neuropathy, he was in the same mindset. You can't heal neuropathy. Like, once the nerves are affected, it's kind of always, once they're always there. And
generally they say, I think it gets worse too.
Yeah.
Like, it just kind of compounds. Just for those viewing, like, would you be able to describe, like, the pain that you were experiencing with the neuropathy? Some people don't really understand what it is and how it feels, or
and this one, so my left foot, it was like pins, needles, not a significant amount of pain. It just felt like kind of almost dead. Like, there was like just didn't have full control of it, when you're walking, just unsure of even like whether or not, taking the step, if it was going to be able to like feel, the going up the stairs, like, is it feeling the actual step? Is it not?
Pastor
Those
Ryan,
pins and
is it
needles.
like that feeling when your foot falls asleep and you want to get up out of the chair and it's like, well, all right, I got to get it to come back, but I'm afraid to even take a step because you're uncertain as to, you don't feel confident. Is it like a similar feeling?
Yeah, I'd say similar. Mine was a little more like a numbness than the firing on all cylinders.
Yep.
What's interesting right now is the cancer after 9 years came back. So I'm currently back on some treatments, and rather than it being in my foot, I'm feeling, whether it's the medications or the effects on my body, I'm feeling it in my hands, and it's much more of a hyper, like, sensitivity firing. And I was experiencing a lot of pain. About a month ago, I think we've had three,
Three
four,
or four sessions.
3 or 4 sessions, and I couldn't sleep at night. I was getting maybe 2 hours because of the pain. I would just wake up and have to like hang it off the bed or try and just. And
Mm.
now I've got a little bit of just that sensation still, but zero pain over the last couple weeks. Again, because we started back into the craniosacral work.
Wow. Um, Unfortunately, when you hear that term craniosacral therapy, most people don't know what it is, number one. Number two, it sounds scary, but it's not. Can you explain, Pastor Ryan, basically what was going on there?
Yeah, and I'll be really honest, which I know KellyAnne wants me to be. Like at first, I thought, like, she's just touching certain points and holding certain points.
This is
Like,
stupid. I would have said
this
the same
is
thing.
like
Yeah.
hokey. Like,
Yeah,
Right.
what kind of dark magic is it?
and I, thankfully though, I've done chiropractic since I was a teenager. My parents were really into, health, wellness, chiropractic. So I was willing to stay with it uh, long enough to see. But I literally, I think it was our first session. Um, KellyAnne like was putting pressure on one point, and then moved her hand to another point, and asked the question, like, what are you feeling? And all of a sudden, like, I could feel a rush and like something change. And she just went through, kind of, was pressure points the right term? Or
So yes and no. There's different parts of the nerve lines, and I believe in a previous episode we had showed you that nerve line chart. So basically, we're taking the spine, finding the points on there where your nerve lines are not functioning properly. There's things called facilitated segments, which is what Pastor Ryan here had. Quite a few actually. Basically, what that is there are certain areas of the body where there's no CSF getting to those points, but that fluid still has to go somewhere, so it's dispersed elsewhere. But if you're having multiple facilitated segments where it's not getting where it needs to go and it's being flooded in other areas, you have these rushes where it's too much CSF is being flooded in these areas, so it's actually amping up. So when you're plugging certain points to pinpoint where these facilitated segments are, that's where you're going to get the rush feeling. You're going to feel like, oh my gosh, like that intensified the pain or the tingling or the numbness. And so we're testing to see, okay, where exactly is this point that needs to be dissipated so we can open it up so the CSF can flow in. So everything is kind of at its normal capacity versus flooded over here, not getting any over here. And then kind of reconnecting the nerve lines if that's even possible, because with unfortunately cancer and chemo, it's killing things off. Things aren't going to function the way they should, and sometimes it doesn't come back. So sometimes it's also knowing how to reroute and getting the body to kind of take a different approach, but still get the same outcome where, okay, your leg can't use this nerve line anymore because it's dead, not functioning, but we're going to reroute it this way, but it's still going to get circulation to the feet, to the toes at a different route, and kind of getting the body to reorganize itself essentially, and find a different way to get the same jobs done. Because I think you were also experiencing some uh, lack of circulation in the feet. Because I remember testing and making sure, because I think the feet were just so like they couldn't glue the toes were turning blue.
Yeah, they were cold all the time.
Yeah, and he couldn't regulate temperature. And how are you feeling now? I mean,
Yeah, my foot's totally like I don't.
he's wearing
There,
sandals, by the way.
there's no.
No socks either with him.
Yeah, at this point, like I would say I have zero issues with my foot, which is again what my specialist was just like, this just doesn't happen. So there's got to be something to this, and yeah,
Wow. KellyAnne and I have spoken, a few times before, and I'm blown away even hearing this story. First of all, it seems, Pastor Ryan, that you felt relief very, very fast. Am I hearing that correct?
yeah. It was within, like, on my foot, it was within a month again.
Hmm.
Started to notice some difference, and
Sure.
we probably continued several months that first time. And this time I've been, I think, about 4 weeks specifically doing cranial work this time. And again, it's not gone yet, but significant difference with
Wow.
just the first 4 weeks.
This is amazing. And using your situation as an example, the rewiring of the nerves without going underneath the hood, if you will, just by a massage therapy is mind blowing. That KellyAnne, you're able to do that. That's wild.
Yeah, so cranial work is different than the massage. So it wasn't like massage like he explained. It was working with different points, but like I
Sure.
do incorporate massage with it. So I think he's even gotten both in one session.
Yeah.
So if you book like a 90 and you need two different types of therapy, which would be massage and cranial work, we definitely incorporate both of them at the same time. That is a possibility. But also I just wanted to clarify, he said months is when he was like feeling better. That's generally within like 4 to 6 sessions, like
Right.
once a
Yeah.
week. Just to give people like an idea time wise and how many sessions. That when you say a month, that could be every day or
Yeah,
no,
that's good.
ain't nobody got time or money
No.
for that.
Yeah.
Just kind of wanted to clarify that one, but yeah, the nerve lines and working through them. I don't know. Can you explain like how that felt? I know you told I'm touching different things.
Yeah, like I think what's so interesting about it is as you're I would say, like, it's almost because you're in an environment. So number one, KellyAnne creates an environment that is, number one, it's like safe, it's restful, it just it allows for kind of being aware of what's going on. And so in that, as she's talking you through it, it just you really can zero in on what am I feeling, what's going on, and as she's asking specific questions, it just allows to say, like, she'll say, in this point, do you feel pain here? Not really. She'll move over slightly, and it's like, there it is.
Wow.
And I don't know that I would, I'm a go guy, so I wouldn't be recognizing that, but she creates the space to be, cognizant of what's going on, and then to partner with her in that work. And I think that's a big piece too. Like, I never refer to KellyAnne's work as just massage. I always clinical massage, because one of the things I most have appreciated is, like, she comes at it from really from the body, looking at those nerve lines and the skeletal system, and from a much more medical standpoint, rather than, I'll just say, kind of like foo-foo massage, which I've had some, and it, whatever, it feels okay.
Mhm.
But I've always found that what KellyAnne has done, it's a part of the healing process in just a much different way. And so I wish insurance would cover more of this, because it's just done things for me that have been just super like ridiculously helpful, quite
It-
honestly.
Amazing. And it's the education that we're doing here, but how she educated you. And I have to believe that that's probably part of the process where you feel more comfortable. You're wondering, what are you doing? What's going on, especially in the first few weeks, like you said before, you're probably thinking, well, I'm going to put my faith in this, but I don't know where this is going to go. She's just massaging me. But what it seems like, what a difference it made in your life.
Yeah, absolutely.
Wow. Wow. KellyAnne, what do you want people to know about craniosacral therapy that maybe we didn't touch upon?
Yeah, so craniosacral therapy can definitely, it's like an umbrella. Like there's so much that can be dealt with underneath it. I mean, for Pastor Ryan here, I mean, it's been more of like a physical help too, like regaining his touch, reducing the neuropathy. It can help with clinical ailments. I've also been in cases where it's actually cured autoimmune things, where people are having disorders in their body, food allergies, sorts of things where their body has shut down. And of course, you know, on the medical side, they're going to be dealing with it with either medications, depression, um, things, or just therapeutic like talk therapy. Um, Cranial work, it's working with the nervous system, and the nervous system is attached in so many ways to organs, to different visceral tissue layers, and with trauma that's stored in it, like I said before in previous episodes, it can manifest into physical ailments. It can manifest into like behavioral disorders, depending on the type of trauma, how the body's storing it, how the body is not able to contain it, and how it's coming out in different ways of the body trying to process it in not necessarily healthy ways. So there's the biomechanics side, which is more of what we worked with Pastor Ryan here, which is me going in, manipulating the visceral tissue, rerouting the nerve lines. That's more the biomechanics side. It's me physically going in and kind of working those things. Now, the biodynamic side, I don't think we've ever really delved into that. That's more of like the somatic emotional. So if someone's coming in with emotional trauma, sexual trauma, those types of things, we're going to be working the nervous system, yes, and different nerve points similar to it, but it's not going to have necessarily like a physical, it can take on a physical like manifestation in the sense that they might feel something. They might feel like nauseous or something where like the trauma was so sickening it made them physically feel nauseous. So there's so many cases where I find that cranial work is just like the missing piece, because a lot of times people come in like, honestly, I'm their last resort. Most people are coming in, I've exhausted all medical options, all medication options, I've not gotten the help. I'm just out here trying to find something for even just a little bit relief. That's the state most people come in, and I'm sure, was that what you came in with too? I mean, you've been all through sorts of doctors and stuff.
Yeah, I would say somewhat. I think because of the chiropractic background, I've tended to go down the natural paths before medical
Oh,
paths.
okay. So you're the other way.
So I'm a little bit the other
Okay.
way, but on this one, you know, with the cancer specifically, I mean, I did follow the doctor's orders pretty concisely. So yeah.
Yeah. So
But I think it is true, and a lot of folks that I've pointed to KellyAnne, they were kind of like at a
at their worst.
desperation, like
Wow.
they didn't know what else to do, and it would have been their first time. And I remember talking to some of them too, and they were the same way, like
That
after
doesn't
the
sound
first
good.
session, like I don't know, she didn't do anything, kind of. But then actually, the three or four that I have recommended, they've all experienced
Wow.
a lot of help as
It,
they've
it,
continued.
it's a shame that many of us, and I understand it, no judgment, that we have these aversions to things we don't understand. Like one of them, hypnotherapy. I had it a few years ago. What was I waiting for? Do you have this perception that you're mind control? No, it's you're being allowed to access your mind and then have a favorable result. Now, with Pastor Ryan, KellyAnne, with the neuropathy that he was dealing with, was there any traumas involved? You've mentioned that a number of times. Is the treatment, the cancer treatment, considered a trauma?
I honestly, anything that would, from the medical side, like inserting needles, like even just an IV, that can be very traumatic to a child, whereas an adult would be able to process that differently. but to a child that definitely can be a trauma. Some adults who maybe don't receive needles well, that can be a trauma.
Sure.
It is a form of trauma in my book to the body because you are pouring chemo, which is essentially a poison trying to kill something in the body. It is going to have a physical, medical effect on the body. It's going to be changing things in the body. And obviously, it definitely did with the nerve lines in his body. It definitely had a significant impact and effect that would have lasted had the therapy he not received it. So I would classify that as a type of trauma. But again, I think we discussed this before that trauma is a very broad umbrella term. And we even coined, I think you were so kind to coin the terms big T trauma and little T trauma of just, car accident versus, falling off your bike,
Right.
as a kid.
Or
But
somebody
both
saying
could be
something
significant.
like if you're
Yeah.
7 years old and somebody says something about a drawing that you made, and you
Mhm.
just you're creating art, and somebody says, "Well, wait, this guy's not. It's not supposed to be green. It's supposed to be blue. You know better than that." Little T trauma. Yeah. Um, just to illustrate this, cranial sacral therapy, Pastor Ryan, what was it like? What did it feel like? Was it just you're there on the table, so to speak, and she's just doing a massage technique?
Um, yeah, yeah. Again, it's so really specifically on back. For me, it was on my back, and then she would um start up in kind of the top part of my neck, in right at the base of the skull, and where the neck joins and
So back here.
back there, yeah. And
Back here.
and she would kind of just hold up, and again, I'll use the word like it's applying. She knows exactly where to go based on her knowledge of the nervous system and the spinal, uh, cord and all of that, and literally just going to certain places with her hands, and then applying, the right amount of pressure. It not painful in the least, and I think that's the piece, you're expecting with clinical massage, like, oh, she's gotta push hard.
Hmm.
This isn't that. It's the
Like the
right,
weight of a dime. That's how
yeah,
much pressure that you're putting on somebody. But I know you say there's no pain, but there were times I'm like touching and you're like, oh, that's the spot.
yeah.
So like you do feel it.
And you don't realize, like, I don't know how much pressure she's applying, so
Yeah.
I'm thinking it's, significant pressure or not significant, and it could be, but it was literally, there's a couple times where I've fallen asleep while she's doing it, and you know
Wow.
it's really unique. It's unlike anything. um, Again, it's its own work, that I would, again, I just can't argue with the fact that the neuropathy is not there. And that's where my doctor, who, very, very medical, very, very, like, we walk this line. He was like, listen, I've never had a patient that's had neuropathy go away, so there's got to be something to this.
Wow.
And again, he couldn't argue with it.
I have friends that have neuropathy. One of them in fact, from diabetes, and I didn't even know the cranial sacral therapy can support it. By the way, side note, as you were showing how you support the head from the back by the neck,
Yeah.
um,
It's still here.
anytime I've had like just traditional massage and the therapist has done that, that is the best feeling in the world. I don't know what's going on back there, but it's just like,
Yeah, it's
don't
true.
stop.
Yeah.
Yes, exactly it. It's just a light pressure back there because it's those are points that you never touch, you never get to. Thank you both for all the insight today. Really amazing, and also letting us walk that journey with you in just a few minutes, Pastor Ryan. KellyAnne, got to be in person to get this done. Can't be done virtually, unfortunately, at least not yet.
But yeah, I
Um,
don't know.
how do we find you? You're in Pennsylvania, right?
Yes, I'm in Camp Hill in Pennsylvania. I am in a corporate building. There's multiple businesses in the building, but we have our own private little suite here at 355 North. I'm saying North. I should know this. Um, North 21st Street, and we're right by the Holy Spirit Hospital intersection there. And Suite 300, and there is an elevator in case that's helpful for people to know. We do work on patients that have wheelchairs, prosthetics. We take all kinds that have rods, pins, fusions. We work with everything. So yeah, there's nothing really stopping from anybody coming. Everything is wheelchair accessible. So
I drive a half an hour to come.
yeah, we have some people coming from Hershey, and I think we even had one person come from New Jersey.
Wow.
So people are coming from further around, and we are getting more doctors referrals in. So we are getting busy. We are booking about 3 and 4 weeks out. So just as a heads up, if someone's calling in, I need to get in ASAP. It's going to be a 3 to 4 week out.
Gotcha. Yeah, well,
Yeah.
you know what? There's a reason, because you're good. This is your passion. This is your reason for being. In my book, you are the craniosacral expert. There's nobody that runs as deep as you do. And being able to explain it so we understand it. I truly believe, KellyAnne, that is one of your superpowers. Both of you, again, thank you for being here. And Pastor Ryan, thank you for all your insight, and all the best, in the future treatments with you.
Thank you.
Great. Thank you so
Appreciate
much.
it.
Appreciate it.
Thank you. We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.